Today, we're talking about something that literally changed the world: hormonal contraception. And we're going to get into the science of how it all works, really zeroing in on this one super important hormone and the lab-made versions that made it all possible. I mean, think about it. How does a tiny little pill control one of the most complex systems in the entire human body? It really does seem like magic, doesn't it? But of course, it's not. It's actually some really clever biochemistry. The whole idea is to basically trick the body into thinking it's already pregnant. So let's break down exactly how that works.
Okay, so this whole story really revolves around one main character: progesterone. You can think of it as the body's natural gatekeeper for the reproductive system. It's the one in charge, deciding what's allowed in, what's not, and when.
Now, here's a really important point we need to get straight. Progesterone is the natural stuff, right? The problem is, if you just take it as a pill, your body breaks it down and it doesn't really do anything. So scientists had to get creative. They developed something called progestogens. These are synthetic, lab-made versions that mimic progesterone, but they're stable enough to work in a pill. Honestly, these are the real heroes of the story.
So what's on this gatekeeper's job description? Well, a few key things. First, it gets the uterine lining ready and welcoming just in case a fertilized egg needs a place to implant. Second, it makes the cervical mucus really thick and hostile, basically creating a roadblock for sperm. And maybe most importantly, when progesterone levels are high, it sends a clear signal to the brain that says, hey, shut it down, we don't need to ovulate right now. It's basically putting up a giant do not disturb sign on the whole system.
And that was the light bulb moment for scientists. They realized, wait a minute, if we can control progesterone, or at least the mimic of it, we can control the entire cycle. And that single idea sparked a true revolution: the pill.
So the very first version of the pill, what we call combined oral contraceptive pills, or COCPs, they didn't just use one hormone. They use a 1-2 punch. They took that synthetic progestogen and combined it with estrogen. This made the lock on the system even stronger and more reliable, especially when it came to stopping ovulation in its tracks.
But like a lot of first drafts, this breakthrough was, well, it wasn't perfect. Not by a long shot. The problem was the dose. The amount of hormones packed into those early pills was really high, and it led to what a lot of the research at the time called intolerable side effects. A lot of people just couldn't stick with them.
And we're talking about a whole range of issues here. Some were just unpleasant. Things like nausea, headaches, weight gain. But some were actually dangerous. That high dose of estrogen, specifically, was linked to a higher risk of venous thromboembolism, which is a fancy way of saying dangerous blood clots. So the basic idea was right, but the formula, it needed a ton of work.
And that's pretty much the story of the pill for the next 60 years. It became this ongoing quest, this scientific mission to find that perfect sweet spot. What's the absolute lowest dose we can use that's still super effective? The goal was always to slash the side effects without losing that reliability.
You can really see that evolution right here on this timeline. Back in the 60s, you had these high-dose, one-size-fits-all pills. Then you get to the 80s, and things get a little more sophisticated, with biphasic and triphasic pills. The idea there was to vary the hormone levels throughout the month to better match a natural cycle, which also helped lower the overall dose. And that brings us to today, where we have these ultra-low dose pills that are just as good at preventing pregnancy, but way easier on the body.
Wow, and this chart just says it all, doesn't it? Just look at that drop. The amount of estrogen in the first pills compared to what's in modern ones is just staggering. It's a huge difference. This really shows the shift from a kind of brute force method to something much more refined and targeted. And honestly, this reduction is probably the biggest reason why the pill is so much safer today. Okay, so the pill got way better, way safer, but even the super refined ultra-low dose version still isn't the right choice for everybody. And the big sticking point, it's that estrogen. For some people, taking any extra estrogen is a risk. And that reality pushed science to innovate yet again.
So what do? What if you're breastfeeding, or you're over 35 and you smoke, or maybe you have a history of blood clots? What are the options then? Well, the answer was to go back to basics, back to our original gatekeeper hormone.
And this table breaks it down really nicely. The solution was progestogen-only methods, which people often call the mini pill. As the name suggests, it takes the estrogen completely out of the equation. This makes it a much safer choice for people with those specific risk factors we just mentioned. Now, there is a trade-off. You might get more breakthrough bleed-in, and you have to be super strict about taking it at the exact same time every single day.
You know, it's also really important to remember that these pills aren't just for contraception. Especially the combined ones, they have some pretty amazing non-contraceptive health benefits. That steady dose of hormones can really help with things like painful or irregular periods. But here's the really wild part. Studies show that using them long-term is linked to a much lower risk of getting certain types of cancer, like ovarian, endometrial, and even colorectal cancer. Pretty incredible, right?
Okay, so everything we've talked about so far has been about regular, ongoing prevention. But what happens when plans change? It turns out the same science can be used for very specific, time-sensitive situations too.
This is where emergency contraception comes in. It's built on the exact same principles we've been discussing, but it's a different tool. It uses a higher dose of a hormone, usually a progestogen, to interrupt the cycle after unprotected intercourse has happened. But, and this is a key point, before a pregnancy can actually get established.
So how does it pull that off? Well, it's got a few tricks up its sleeve. The main thing it tries to do is stop or delay ovulation. I mean, if there's no egg, there can't be a pregnancy, right? But it can also do other things like mess with the transport of the egg or sperm. And it can even change the uterine lining so a fertilized egg wouldn't be able to implant. Think of it like a safety net with multiple layers.
And finally, we have to talk about one more type of medication that flips the whole script. Instead of mimicking progesterone, these drugs do the exact opposite. Something called an anti-progestogen, like mifepristone, actually blocks the progesterone receptors. And if you block the gatekeeper, the uterus can no longer support a pregnancy. This is the mechanism used, along with other medications, for a medical termination of pregnancy.
So when you step back and look at the whole picture, it's pretty amazing. Our understanding of this one hormone, progesterone, has given us this huge, sophisticated toolkit for managing reproductive health. We went from a single, clunky, high-dose pill to this whole range of refined, specialized, and much, much safer options. It really makes you stop and think, what on earth will the next 60 years of innovation look like?